So the U.S. reporting 180,000 cases. That was 180,000 cases of COVID-19 in children. That was just last week. So to put that into perspective, near the end of July, we were at about 38,000 cases per week in children. And this, of course, with kids heading back to school very soon, an actual classroom. So it could get worse. Joining me this morning to talk about this, Dr. Elizabeth Mead, a pediatrician with Swedish Medical Center. Doctor, thank you for being with us. We know you're busy. We appreciate you joining us. Good morning.
Good morning.
So we are seeing more and more states reporting, I mean, we just showed you the numbers here, that COVID is running rampant through schools. And as we get ready to send our kids back to school, I mean, do we need to be concerned about that happening here?
Well, I know parents are very concerned about that happening. And I think for many good reasons. I mean, I will say, I think we have excellent strategies in place to really limit that transmission and that spread at school. And we can talk through what those look like. So many places where this is spreading are places that are not mandating masks for kids, that are not really using those layered prevention strategies. But the reality is Delta is much more transmissible, as we know. And so we are seeing numbers go up really in every age group across the country.
All right, so when we talk about that, I mean, you said yourself, like, our state has a plan. It seems to have some strategies that doctors seem to be on board with as well for, keeping Delta at bay. But I do want to ask you this, because a few months back, we had a pediatrician on our show saying basically that pediatricians across the state were urging to get kids back to a physical classroom because of mental health concerns. I mean, we've all seen it. We've seen the studies that, kids' mental health has really struggled during the pandemic. But has that perspective changed? I mean, you're a pediatrician. Has that perspective changed at all now that the Delta variant is starting to rage?
I think the perspective and the guidance has always been that we need to get kids back in the physical classroom as long as it is safe for kids and for teachers and staff to do so. And so last year we found that we could do it very safely when we layered those strategies like masking and distancing and symptom screening and all of those things, right? And this may change things. I think all the information that we have right now suggests that with all of those strategies in place, that still can be done safely, but we have to be willing to change our guidance and change our plans if we are finding that despite using all of the strategies that have worked so well for us thus far, those numbers are starting to go up.
Yeah, definitely you're noticing. I mean, we've seen it through businesses and schools. I mean, everyone is trying to be as flexible as possible. We are also seeing, I mean, besides the indoor mask mandate that just went into effect this week, we've also got employers doing vaccine mandates, mandatory vaccinations for state and school employees. Do you think that mandate will help?
I do. I mean, honestly, the more people that can be vaccinated, the more we'll see these numbers go down and really get in control of this. The way out of this Delta surge and the pandemic in general is getting people protected. And the best way we have to do that is through vaccination. And so we know that if we can get the majority of folks vaccinated, that we'll see those numbers go down when we're talking about things like hospitalization, severe illness, ICU beds, and death, which are really all the reasons that we're having to use all of these strategies in terms of public health to try to get those transmission rates down. If everybody got COVID and all they got was a mild infection, we would not be having the discussion we're having. But the reality is that people are getting very, very sick. They're dying. They're ending up in the ICU. And they're really affecting our ability to care for patients with any medical problem, not just with COVID.
I want to ask you that. You just mentioned it. You're seeing people ending up in the ICU. We just heard from the state today. Hospitals are overrun. They are stretched to the limits. I mean, you're a healthcare worker. You see this every day. You are on the front lines. How are you feeling when you're seeing people unwilling to take measures and maybe ending up in the hospital?
I wish that we could tell the stories of the patients that we're caring for. They're not our stories to tell, and for very good reason. They're protected by privacy. And when people choose to share those stories, I think it's really helpful. But we're talking about young, healthy people ending up in the ICU, dying. We're talking about pregnant women ending up in the ICU, dying, never getting to meet their babies, having to have their babies taken out by C-section months early because the moms are dying or so sick that they can't support that infant anymore. And these are the stories that I think are so important for people to understand. These are not just numbers. These are real people who are affected. So I think it's getting really hard for us as healthcare workers, knowing that we have vaccines and we have a way to really prevent that serious illness and not being able to do that for everyone.
I agree with that. It's getting hard. I mean, I can't even imagine how hard it is for you. It is very hard for people in the media right now. I'll just say we get tons of messages all the time saying COVID's not real. You guys are just, this is a conspiracy. You are the professional. You are, living in the science here. What is your message to people who are saying these things?
Yeah, I mean, again, I wish I could take everybody through the ICU to see it because
Yeah.
it really is, I think, unfathomable unless you really understand what's happening. And I understand there are so many mixed messages out there, but I will tell you, as someone who is pretty much living and working in the hospital at this point, it is real. It is very serious, and unfortunately, there is not a way to predict who gets very sick. So we can't say that if you're young and healthy, there's zero chance that you're going to be affected. There's a significant chance that you could end up getting really, really sick with COVID. So I think the message for people is the absolute best way we have, not just to protect our community as a whole, but you as an individual, is to get the vaccine. And I'm very hopeful that the full FDA approval for Pfizer will help people understand that it is safe, it is effective, and it is really the way out of this for all of us.
Yeah, that full FDA approval just coming this week. Dr. Mead, it's always so good to talk to you. Thank you for taking the time. We know
Thanks
you're
so
busy,
much.
and thank you for being on the front lines right now. We appreciate it.
Thanks for having me, Liz.